Thank you, Mr. Chairman, and thank you to our excellent witnesses that are with us today. My condolences to Mrs. Satterwhite for the loss of her brother. And I want to thank, in particular, Nicole Howell, whose work in my district in Contra Costa County has been incredibly important. Thank you for all that you and your team are doing. This is an important hearing. It's a tragic one, Mr. Chairman, but it's an important one. COVID-19 has ravaged every part of our society, but nowhere has it hit harder than in our nursing homes. And it's been exacerbated, as pointed out by Mr. Grabowski, Ms. Kennedy, and Ms. Gold, by the fact that family members aren't allowed to visit their loved ones. And they are themselves ombudsmen for this industry and for the patients who are there. I have a woman in my district who quit a very lucrative job and took a job in a skilled nursing facility so she could be close to her parents, to be able to watch over them. So this is really an important issue. As Ms. Howell knows, Contra Costa County had 18 deaths last week. 16 of them were in nursing homes. In my conversations with local public health officials and nursing home operators themselves, a few things have become clear. First, there's still not enough PPEs. Second, once COVID appears in a nursing home, it's basically impossible to stop. And third, wages for nursing home employees are way too low. Fourth, the measures required to contain and mitigate COVID in nursing homes are too expensive for many nursing homes to implement. They need our help. I'd like to ask Ms. Howell a question. You recommended in your testimony that nursing homes and long-term care facilities increase wages for employees. In my district and other places.
Will you tell them?
I can't hear.
Can you hear?
No, I'm sorry, you cut out for a second.
Okay. The low wages has exacerbated the problem because employees have to work in 2 or 3 different places, and they 2 or 3 different skilled nursing facilities or nursing homes. So they bring in the infection and spread it in their many places of work. So can you talk a little bit about that and how important this is?
Thank you, sir. I appreciate it, and I'm privileged to serve your community. I think you've raised what is the critical issue, which again is the gasoline to COVID-19 match. And I want to say I don't think this is just a byproduct. I think it's part of the system design in that the way long-term care pays for its employees is at the lowest possible rate, and then at the same time says we can't get staff. You have to pay appropriately for what you are trying to get, which is someone who's been trained, has received appropriate training in person-centered models of care, LGBTQ issues, as well as others, and effectively recruit staff. So when we have staff members that are working at multiple facilities that we know where there are active infections, we cannot be surprised when the disease spreads. I submit to you that you as a Congress did provide additional compensation and did encourage facilities to use that for staffing members, but that has not been done. Or it may have been done on a modest level of maybe $1 more an hour, but that does not significantly compensate for the risk that they are taking. And so I understand when staff members are saying, no, I will not come to work.
Thank you very much. I also have a PPE question, and I think Dr. Grabowski is probably the one that I should direct it to. I still have skilled nursing facilities who are trying to track down PPE material and equipment, and this is like way too long into the process for this to be happening. Dr. Grabowski, did the Trump administration implement a clear, comprehensive plan for distributing PPE?
Thanks for that question. No, they didn't. We really should have nationalized the acquisition of PPE from the beginning of this pandemic. Unfortunately, nursing homes and other long-term care providers were left at the back of the line. So hospitals and other systems were bidding up the price of PPE, and nursing homes just simply couldn't afford it. So it's not enough to simply give them the dollars to purchase this. We actually, in some cases, need to help them acquire the PPE because they just can't afford it at the going outgoing rates. And so we could be doing a lot more. And unfortunately, the administration didn't kind of connect the dots there in terms of providing the resources and getting the PPE to the nursing homes and protecting our caregivers.
Thank you very much. I yield back, Mr. Chairman.